everyone, my name is Elena Alam and I was the Dutch Youth Delegate to the World Health Assembly this year. Next to being a youth delegate, I was also a final year medical student in the Netherlands, and during my studies I was always very interested in global and public health. So being a youth delegate was an amazing opportunity for me to learn more about these fields of work, as well as an opportunity to use knowledge and skills I had gained during my studies and apply them to this new type of work as a delegate to the World Health Assembly. So as the youth delegate, my main topic of interest and work was the topic of climate change and health. This topic has been of interest and of concern to me for a couple of years now. Climate change and health are very closely intertwined, but still a relatively new topic in the medical field. More and more studies are being published on it, and next COP, which is the yearly UN Climate Change Conference, is the first one to have a day dedicated to health, while it's already the 27th edition of the COP. So, why is it important to understand the link between climate change and health? Well, climate change has tremendous impacts on the health of our planet and therefore by definition the health of human population. And the effects of climate change we see happening all over the world, such as rising temperatures, more extreme weather events, rising sea levels, lead to different poor health outcomes, such as more and more severe asthma cases, an increase in cardiovascular disease, more vector-borne disease cases in totally new areas, more malnutrition, more injuries, more deaths. And these are very tangible problems that we as future doctors have to deal with in our hospitals and in our practices. And because the world isn't doing enough about the underlying causes of climate change, such as fossil fuel use, we will see more climate change related illnesses and deaths in the near future. Meanwhile, medical students and others who will be working in the medical field aren't given the proper education on these topics. And this is not only concerning because of the very real impacts of climate change and health, but also because the healthcare system plays a big role in causing climate change. Now, of course, this differs all over the world, but in the Netherlands, 7% of the national CO2 emissions are caused by the healthcare system. And this is a statistic that not many people, and even medical students, know. Therefore, the healthcare system has a big responsibility to become more sustainable. Because when it doesn't, it will create its own patients for the future. I think there is a very large role to be played by young people in the field of climate change. Young people as a group are concerned about climate change, and rightfully so. I am a firm believer in working on, or at least trying to do something, about topics close to your heart. On an individual level, it helps combat climate anxiety, when you're actively involving yourself in the solution side of things. And on a more collective level, that very personal and urgent worry makes others listen to youth and put the topics on the agenda. Youth are a very big part of today's society, making up 16% of the world population. So our opinions are not just opinions of a few. We're a significant group and we have important things to say. And we should be listened to. So, moreover, as youth, climate change is a topic which will be very much influencing our futures. We will be dealing with decisions that are made at this very moment. Therefore, it is key to be involved in these decisions. During my year as youth delegate, I learned that there are many people out there who are willing to listen and work with us because they see youth as a future and as innovative thinkers who come up with creative ideas and solutions because they are relatively new to the field of global health policy. At the same time, and I always think this, we have to be careful that we are not solely responsible for solving the issue. We do need those in positions of power to listen and actively change policies and current trajectories. So, as As the youth delegate to the World Health Assembly for the Netherlands, I had the opportunity to deliver a statement on behalf of the Netherlands, and I was able to share my experience as a medical student at the time, as well as my concern for my future work as a medical doctor. And by sharing my perspective from the very basics of the field of medicine, so the patient-doctor relationships, I hope to inspire other delegates to be willing to change and support the new World Health Assembly resolution that will be presented next year.
Netherlands followed by Maldives.
Thank you, Chair. Distinguished delegates, my name is Elena Alam. I am the youth delegate and soon-to-be medical doctor from the Netherlands. And I'm extremely concerned about the impact of climate change on health. My own health, the health of those that are dear to me, the health of our planet, as well as the health of my future patients. I am this concerned because the effects of climate change on health are numerous and profound. The recent IPCC report was painfully clear. Climate change is already causing irreversible damage to our well-being and the health of our planet. The WHO itself has named climate change as the single biggest threat facing humanity. If we continue on the same path, the young people of today will continue to face more waterborne, foodborne and vector-borne diseases, more heat stress and cardiovascular failure, more injuries and fatalities, as well as mental health problems. Climate change is a threat that will affect all of us, but some of us are more vulnerable to this threat than others. My parents are from different backgrounds, my mother being from the Netherlands, my father from Bangladesh. I feel extremely privileged to be brought up in the Netherlands, where the impacts of climate change are currently less visible and still manageable. Due to historic reasons, Bangladesh has not been so lucky. This inequality hurts. The World Bank estimates that in Bangladesh, rising sea levels and coastal erosion may lead to the displacement of 13 million people by 2050. This number is awfully close to the whole population of the Netherlands, approximately 17.5 million, whose livelihoods are protected by dikes and dams against the same threat. However, climate change not only exacerbates global inequality, the inequity is interwoven in the fabric of our societies. In the Netherlands, research shows that in areas with worse environmental conditions, such as poor air quality, are often the same areas where people with lower incomes live. These will be my future patients, people to whom I have to explain that their health outcomes are worse purely because of their socio-economic status. The science is clear. The climate is changing. So why aren't we? The time to act is now. This year we celebrate 75 years of WHO, a significant milestone and a great achievement. Let's make sure that in another 75 years, in 2098, on the eve of a new century, we can look back and be proud of the change since this moment. I commend the WHO on having a global strategy on health, environment and climate change. However, climate change is too urgent of an issue to be added to the margins of such a strategy. The Netherlands is in discussion with multiple member states and would like to propose drafting a WHA resolution on climate change and health. Such a resolution is important to respond to the current and future levels of threat to global health posed by climate change, and to maximize the health co-benefit opportunities. I hope all countries can express their support for this resolution. Moreover, I invite you to work together with us, young people and future healthcare professionals, to advocate for equity-based change in your future health-related work in all sectors. Health is a powerful argument and tool for change, for the benefit of my future patients and all other people worldwide. Thank you all.
Muchas gracias.
So the most valuable piece of advice I received when starting this position is when you feel strongly about something, just do it. It always seems daunting to start in a new area. I found it as well when I started this position. It's because you have so much to learn and so much to see still. But everyone started in their position somewhere. And I found that people in the global health field are very welcoming and uplifting to others who are new in the field. So when you're curious or ask for help or connections, people are very willing to help you. The global health world is very broad and at times it can be overwhelming. So try to study a relevant topic or involve yourselves in extracurriculars. especially during your student years, there are many initiatives out there for you to learn from. For me, it was the Youth Delegate program. That was one of the things I did. But I also participated in a global model WHO, which was set up by students in collaboration with the World Health Organization. So the world is your oyster. Just Google or LinkedIn your way through all the opportunities and never be afraid to send someone who you think might help you a personal message.